This is a 7-year-old girl with a diagnosis of CVA, which she sustained sometime around birth. She was preterm by 3 months, one of twins, and she also has a seizure disorder. She's got bilateral effect, but more so on her left than right, and speech delay and cognitive delays. When I first met her, this was about 2 years ago, so she was 5 years old. And at that point, she was unable to walk up and down stairs. She was unable to transition into standing without support. She was unable to climb the ladder. She was unable to walk up and down a curb step. She did have the DAFOs back then, but she had a very, very poor stability and balance and was unable to walk without a gait trainer. And it was about a year and a half ago that we saw her first steps, short distances with DAFOs on. And the progress since she took those few steps about a year ago has been just tremendous. Without using DAFOs, you will see that she has significant pronation of her left lower extremity, such that she is primarily weight-bearing on the inner portion of her ankle versus the bottom surface of her foot, which is being addressed surgically at this point. Toe curling is evident as she attempts to bring the foot in contact with the floor, as is abduction of the large toe. She has a lot of left-sided neglect. She shows a decreased swing through of her left lower extremity walking forward, decreased weight shift onto the left lower extremity, decreased stability overall. She has recently, in the last year, progressed to a lower profile brace on the right, going to a 4, which we're primarily targeting foot alignment, and a 3.5 on the left. We have found that she's showing some good movement over her foot into dorsiflexion and getting just a little bit of toe off as a result of the 3.5. Her gait is very stable with the DAFOs. Her right lower extremity is her stronger side, and so she still tends to primarily shift to the right and has a shorter stance on the left, shorter swing through on the left, but she's been showing tremendous progress with that as well. Probably 6 months to a year ago, she maintained the left lower extremity posterior to her body most of the time. She has been making great steps in bringing that left lower extremity into a nice stride. The big pillow is pretty fun because it gives a lot of vestibular input with some of the rolling around that they're able to do. They can get some trunk extension as they reach for some of the objects down on the floor, trunk flexion as they go to sit back up, and then there's a level of body compression for sensory input as well as they kind of are enveloped by the pillow. It's fun to be on there and to kind of feel that lack of contact with the floor. So in terms of some kiddos with gravitational insecurity, it's a nice place to kind of put them and challenge that sense of not knowing kind of where they are based on the floor, but relying more so on their pelvis and their trunk stability and their visual information. Being on the vestibular pillow is also a fun place to sneak in some stretches. Getting on the ladder kind of forces her to think about where the position of her left lower extremity is, and she has to look at it to place it. So general body awareness is a nice outcome there for her. Come on, Lefty, come on up. We need you. Good job. In the bucket. Yeah. Blue. Working on single leg balance with one leg supported gives an opportunity to strengthen the leg that is bearing all of the weight, the leg that's down, and it allows for an opportunity to get some nice hip extension. 1 foot raised allows for a lot of trunk work and lower leg dissociation, which I think is going to have some carryover in the latter part of stance phase with gait. Again, I'm hoping with the tandem stance to address postural stability and balance in a variety of lower extremity positions, and tandem stance is certainly one that you're going to find with gait. And so it encourages stability and balance with one leg in front, the other leg behind. Just functionally in life, we're going to find that we're going to need to stop our bodies and reach or manipulate objects when we've got our legs in different positions. So it's just a good postural stability activity. Going up and down the ramp in this cone activity, she's working on a number of skill areas, including reaching for objects from the floor to promote stability and lowering to the floor and rising back up. The ramp itself gives us an opportunity to work on stability, balance, left-sided progression, and completion of activity. She needs some cues as she's going up hills and ramps to achieve swing through on the left lower extremity. She's working on her naming of the colors, color selection. Which one? Yellow. Great. Okay. Well, let's take yellow up. Working on her not leaving lefty behind here. Getting a little more forward. She's working on awareness of her environment as she has to scan to find the cone, and then also plan how she's going to make it back up to the stack. We work on obstacle avoidance for safety, getting some nice, more complicated lateral step taking, weight shifting. Allows us to really target her left-sided neglect.